My name is Dr. Ken Mills. I'm an internist and HIV specialist here at St. Mary's Medical Center. I'm in private practice with Mercy Doctors Medical Group, but I also serve as the medical director for HIV services here at the Medical Center. My interest runs far and deep in the HIV community. I was a young internist here at the Medical Center when the epidemic hit in the early 80s. At that time, it was really quite a spectacle. It was pretty tragic, and lots of people became ill quickly and lots of people died. The hospitals were filled with patients suffering from an ill-defined infection that we only later found out was from a virus. People did not live a long time with this medical condition. It was interesting at the time to see who would really sort of step up to the plate, and I'm proud to say that St. Mary's quite early on did step up to the plate in terms of taking care of patients with HIV infection, at least what was later determined to be HIV infection and AIDS. In those early days, I can remember at some hospitals where meals would be left outside of the rooms, or nurses or doctors would refuse to see patients with this illness. Surgeries would not be done. And I guess I'm grateful that I've been around long enough to see all that change and evolve. The treatments have become so advanced and so effective that quite frankly now people with HIV infection who are more recently infected can really plan on leading a pretty normal life knowing that they have a chronic illness. That doesn't take away from the seriousness of the infection and the importance of the proper medical care. Also, we have at St. Mary's, I'm proud to say, an HIV clinic, which I think is one of the best kept secrets in town. We take all comers with HIV infection without concern about ability to pay. All of our providers are HIV specialists. The patients are treated so well, and many of them have multiple problems in addition to their HIV infection. They may have some mental illness, some drug problems, some chronic hepatitis C, and a whole myriad of other medical problems. But they're treated very individually, and they're given very highly specialized treatment, not only on the medical side, but on the social service side. And again, I don't think that there's a better treatment model in town. Historically, we also had an inpatient AIDS unit here early on, which fortunately now, because of all the advances in treatment, there's really not a need for that anymore. And in fact, all the other hospitals the same way no longer have inpatient AIDS units. We also had a very highly specialized AIDS dementia unit that was really the only one on the west coast of the United States, and that's another sort of milestone that I'm particularly proud of. It was really a wonderful place for taking care of patients with HIV-related cognitive disorders, or what we call AIDS dementia. And this was really a very, very special place to work, and we took care of some problems that really nobody else would take care of in the area and actually throughout the country, and even patients from abroad. Fortunately, from a certain standpoint, that doesn't exist anymore because, again, the treatments have been so modernized and so effective that that severe type of dementia is seen much less frequently now. So again, with regards to the HIV clinic here at St. Mary's, it's pretty impressive. Not only do we have our medical model that we provide specialty care, we have access to a psychiatrist, access to all sorts of social service care, but we also collaborate with other agencies in town, Project Inform, the Shanti Project, other agencies that work with other clinics throughout the city. So I think it's that collaboration that kind of keeps us in the forefront and keeps us all up to date on the most modern treatments and care.